Give me a couple of minutes.
You can see this.
Okay, we're live, so you guys can start.
Okay, thank you everyone for joining us today. I wanted to introduce myself first. My name is Dr. Rukhsana Chaudhry. I am the Director of Mental Health Programming for the American Muslim Health Professionals. Today we're talking about COVID-19 and the issues of mental health and mental illness that we're facing today in this country. We're going to be doing a little bit of an overview of what we see as issues that are occurring now, but also in honor of the fact that it is May, which is Mental Health Awareness Month. So we'll be talking about the current status of mental health and mental health issues in the country, along with where we are today in this current crisis as a nation. And I think some of these issues and topics that we cover will address numerous communities, not just the American Muslim community, but other communities that we know are suffering as well, given the circumstances each family and individual finds themselves in today. So in just describing why we think it's important, of course, to get education out today in terms of mental health awareness and the month of May, I think it's important to do a little bit of an overview of where we are as a country prior to COVID-19. And what we know is that in the most recent surveys of mental illness and mental health, 19.1% of US adults experienced mental illness in 2018. So that's almost 50 million people. That represents 1 in 5 adults. I suspect in 2019, those statistics have grown higher. So 4.6% of US adults experienced serious mental illness in 2018 as well. So we know that, you know, this has grown considerably and in the last, 5 years, because at previous surveys done by NAMI and the National Institute of Mental Health has shown that, we're increasing 5 to 10 million every 5 to 10 years. So we need to kind of be aware that that basically every 1 out of 5 people that could be experiencing a mental health crisis or a mental illness ongoing or is currently developing mental health issues. And so the American Muslim Health Professionals aims to be an organization that educates all communities, but also brings together new people into the conversation, or brings in new people into the conversation who may not have had the language of mental health around or themselves and their families growing up or in their communities. And we'll talk a little bit more about how we are doing that through our mental health first aid work. And so, one of the things that we also need to recognize is COVID-19 has presented a specific set of circumstances to people who already have those mental illnesses that I've discussed, and as a statistic. And I want to just, talk a little bit about youth also. We know that at least 60% of youth who experience some kind of mental health issue like depression or anxiety, they don't receive mental health services. Most of that, out of that 60%, that group does not receive mental health services. So we need to kind of increase our ability to, get that access to treatment also available to so many different groups, including young people. And that is also why we're discussing mental health during this month, is to amplify the issue that not every community and not every demographic has this access. So how do we reduce these numbers overall in terms of mental health and mental illness? without offering avenues to treatment. So, that's one of the things that I'd like to highlight today is the importance of that. So we also want to understand that in the recent 7 years, we know that suicide also has become a prevalent issue in the United States. We know that between at least the ages of 10 and 17, the issue of suicide, whether it's suicidal ideation or actual suicidal crises, have increased significantly. So we know that at least 10% of young people have experienced a suicidal crisis in the last 7 to 10 years. So that means that they've increased their necessity for services, but maybe they haven't had the ability to access that. But we've seen a major rise in suicidal crises and tendency in youth. And this is a CDC survey that was conducted within the last 2 to 3 years that gave us a lot of information on the issue of suicidal crises increasing tremendously amongst youth. So these are kind of some of the issues that we're trying to address in the United States currently, and that is not divorce of any community, really. And every community has seen its rise in mental health issues and illness as well as suicidal issues in individuals. So I wanted to give a general overview of that. A quick summary of what AMP is doing is that today we have various programs that are really in the line of advocacy and education. Mental health first aid is one of those. But most recently, in 2017, we decided to attack the issue of bullying in an anti-bullying format by providing a forum and a conference that dealt with people who experienced bullying and then subsequent mental health issues. So that is one of the things that we're continuing to speak on. As we know, youth deals with so many different issues that have to deal with mental health, but there's environmental issues and factors that impact their mental health. And so we want to address both. We also are developing various guides that can be used in mosques, in our own communities, that would be able to talk about mental health and mental illness in a accessible way. And we are offering, of course, our own expertise wherever we can with COVID-19, and also bring together different groups to begin educating the larger public on issues that we may see happening now and happening in the near future. And I know Dr. Shebak will talk more about that. So I will turn that over to Dr. Shady Shebak. He's going to talk about COVID-19 and its impact on mental health.
Hello, assalamu alaikum. Thank you guys all for joining us. Thank you, Dr. Chaudhry, for the nice brief overview of some of those statistics, which I haven't been keeping up with those, so that was helpful for me. My name is Shady Shebak. I'm a psychiatrist. I work here in Dearborn, Michigan. I have a clinic, and I also work with several hospitals and universities. I'm the vice president for AMP, the American Muslim Health Professional Society. I want to discuss a couple different topics today. I want to start out with first the emotional distress that the country is feeling. So, the United States is a very unique country in that it's based on individual liberty and freedom and these types of things. It's like a country that's sort of libertarian at heart, where like, don't tell me what to do, right? We're a different type of nation, really. So when you look at that, and those are not good or bad things, it's just a different type of society that we just have to kind of come to understand. And so imagine the effect that something like this will have on people, where now they are forced to kind of do things that they may not want to, right? The American is always, I want to do what I want to do you, be you, all that kind of thing. And now all of a sudden there's this crisis that's forcing people to close down their shops, their houses, or their businesses. They can't travel as freely as they're used to. So that adds, so the culture, along with this crisis that we're facing, adds, there's an added sense of stress there, that people feel like their freedom and their free will is sort of being stepped on. Whether the people take it to the extreme and protest with guns on state capitals, which is obviously something terrible, or they just sit home and become very, very sad and depressed. these are the things that we're seeing. And we're seeing them clearly. Here in Michigan, we see these types of protests, whether they're protests or people feeling more and more depressed and sad as they sit home. And this is becoming a nationwide thing as we're seeing mental health cases go up, overdoses going up. And I would hypothesize that the mental health crisis from this pandemic is probably going to be, when everything is calculated and all the data is put in, it's probably going to be worse here than many other places because of those values that we hold dear that are also struggling from this pandemic, because we have to stay safe. We have to listen to the health professionals, and that may make people feel like their will is being given up. So it is an interesting thing to consider and to think of in terms of the culture and how it interacts with this pandemic in this country. The emotional things, there's several things also that contribute to the emotional problems in the United States. One of which is that we were, prior to this pandemic, we had another epidemic that we all kind of have come to know, which is the opiate epidemic, which was actually on its way, it was on its way down. And then there was another epidemic that was rising, and that's also the stimulants, right? So crystal meth and cocaine and things like that were becoming more in favor as opiates were starting to decline, but it was still definitely an epidemic. And with this crisis and the inability to get the routine care that people usually were used to, right? Because we were giving people a little bit more of their medication-assisted treatments so that they don't run out and they don't have to keep coming back to the clinic, etc. But that gives them some freedom, and then some people are starting to relapse. Even in my clinic, my practice, I've been seeing a little bit more relapse on that, which affects your emotions, which affects your depression, which affects your guilt, which affects whether you're going to go get treatment or if you're going to buy things off the street. So we have this substance abuse issue that's contributing to the emotional distress from this pandemic. And like I said, it's because people are not getting the regular every 2-week follow-up, right? So we've kind of moved it to monthly. So that's kind of difficult, especially for someone who's newly recovered. So we're starting to readjust our policy for every 2 weeks, but we're doing it via telephone. But I think a lot of people are going on telepsych and telephones and telemedicine. So that also takes time to get used to. So patients or people who are struggling with depression, who have this idea in their head that they're going to sit with a therapist face-to-face, are now with this new reality that, well, it's not really going to be face-to-face. It's going to be face-to-face, but face-to-face like this kind of face-to-face. So that's also something that we have to also consider, that it's going to lead to a little bit some emotional distress because people are not getting what they expect until they get used to it. Once people get used to it, so I've seen people ease into it, and it's worked like a charm. But you have to understand, someone who's in a crisis or in a mental health crisis, that that physical therapy that's there, not physical therapy as in PT, but like being physically there with the patient in the same room, or the client or the person or the friend, that's extremely helpful. And now you have to adjust your mind around that you may not be able to do that, and that this is kind of how it's going to be. And that takes some time. So there's going to be, so someone might have that depression, they go into therapy, or they talk to their friend, or they talk to their family on Zoom or Google Hangouts or what have you. And in the beginning, it's very uncomfortable. But I say you definitely have to give it a go. You have to try to stick with it, because it will eventually, you will get used to it, and it could be helpful. It could be a way to have that social interaction and that therapeutic relationship. Also, the frontline medical professionals have struggled in different ways as well. Some medical professionals have suffered from seeing an influx of infection. That's scary, right? That causes anxiety and panic, and it could cause some trauma depending on how severe the interaction was. And others are struggling in a different way that we are not talking about. We keep talking about shortage. Well, a lot of people being furloughed and laid off as well. And so that's causing frontline workers, causing medical professionals, causing nurses, doctors, etc., to also have a high level of stress, whether or not they're laid off or not. That's something that's in their head. That's something that they're thinking about, and that's something that's in our consciousness. So that's also something that's contributing to more of this anxiety and dread and fear. I mean, what is anxiety other than just kind of like this constant worry of the future? A lot of medical professionals are worried, and a lot of them have been laid off and are home now. So this is also a different type of trauma that's not being discussed. We keep talking about the the front line and the war zone, and well, yeah, but there's another side to it of people sitting at home now who feel unproductive. Because at the end of the day, it's not just about making money that people enjoy. That's not the only reason we like to work and be out, right? We like to be productive. That's part of that spirit of us. And when people are being laid off and people are closing down, it's sad to watch, and it's sad to be part of it. And it's hard overall. It's difficult. That's why I think it's the utmost importance right now for those of us who can to support organizations like AMP, because we really are trying and working on creating programs for people to be able to, like the mental health first aid, for example, is one thing that we're working on to make it also on virtual, which will be very important. And allow people to recognize warning signs and get people to the help that they need. Other things we're working on are these webinars, talks, blogs, newsletters, things that will educate the community about mental health and different resources out there for people to get help. And there's also some talk about working with some organizations that are doing like a phone line for health professionals and others. So this is really the right time for you, if you can, to support AMP with a donation, with a prayer, with an idea, or to get involved with the organization. I think you'll see a lot of good things coming from us. And one thing about crisis and disasters and things like that is it is the perfect time to restructure, to reorganize, and to rejuvenate, and to find where you fit in. And AMP always has open arms for you. With that said, I would like to turn this over to Dr. Omar Shareef, who is going to talk about preparing for the long-term profound effects of COVID-19. And obviously, if you want to field any questions, please do, and we'll get to those at the end of this. Thank you.
Jazakallah khair. Thank you so much, Dr. Shebak, and thank you, Dr. Chaudhry, as well, for the introduction. The two of you bring up, I guess, a perfect framing for everything that we're seeing right now. And what my experience has been here in New York, serving on the front line and also being here in our mental health clinic, is that I'm seeing a short-term shock from coronavirus, and that is the initial shock of the deaths, the damage, the disruption, and of course everyone's coping with this, and that's an acute phase. And then what we're seeing the beginning of, especially us in mental health, we're seeing the beginning of is the fallout from everything that's happening. And what I mean by the fallout is, as mental health professionals, we're seeing the lasting emotional damage and trauma long after each state reaches their peak and are now going downwards. We're seeing families that have lost loved ones. We've seen couples lose their beloved. We've seen children lose their parents or their grandparents. We've seen businesses get destroyed in just a matter of a week or 2 weeks. We've seen investments poof, go out of nowhere. We've seen families financially struggle. Working men and women who can't put food on the table for their families. We're seeing a deconstruction of safety, of security, and of general well-being. And as Dr. Shebak had mentioned, this is ripe for an explosion of new cases of anxiety, of depression, of paranoia, and we're seeing a worsening of baseline for a lot of our patients who are already suffering from mental illness and mental health challenges. We're now seeing an additional socioeconomic challenge placed on top of a mental health challenge, exacerbating all of these conditions. And it sounds grim, when we describe it that way. But as physicians, the first step towards treating someone is to acknowledge the severity of symptoms, and that then guides your treatment. And this is exactly what AMP is in doing, which is bracing for that eventual fallout and making sure that there are structural programs and services in place to help provide comfort and relief to those who need it most. One of these particular programs that I've had the honor and pleasure of conducting is mental health first aid. Mental health first aid is the mental health equivalent of CPR, whereas in a CPR course, you learn airway, breathing, circulation, you learn how to help provide very basic care for someone suffering from a crisis until an appropriate health professional arrives. Mental health first aid is equipping those who do not have a mental health background or any clinical training whatsoever with the tools and the resources needed to identify red flags, emotional red flags, identify risk assessments for those in their family or their friends, and then be able to provide emotional help and support until that particular individual is able to get to a mental health professional. So a lot of this is crisis management. And unfortunately, there was already a lack of mental health support and services available pre-pandemic, but now, as we're seeing during the pandemic, there's a dire need for mental health professionals to be able to service all of those who need it. And unfortunately, there's not enough professionals for each community that is in need. So the best way now to address this sort of problem is to have a grassroots approach wherein if you don't have a mental health professional, what you can do is provide mental health first aid training to boost the level of mental health advocacy, literacy, and training, so that instead of having only one mental health professional, you now have an entire community well versed in the basics of mental health care and are able to identify those community members who are at risk or are in crisis and get them to a professional that is available. So this is an essential service that is needed. And because of the pandemic, we can no longer conduct mental health first aid courses in person. So from the National Behavioral Health Council, the organization that creates the mental health first aid program, there's going to be an online option that's going to be made available, and AMP is going to be at the forefront of offering virtual mental health first aid programming for communities that are interested in getting training. So the rollout will hopefully be this summer. We'll have more details coming out shortly in the next month or two for how you can get involved and help bring this training virtually to your community. So this is something that I cannot emphasize enough, which is the best medication is that which is preventative, not that which is reactionary. And I would implore anyone watching and listening to not wait for a mental health crisis in your community to then respond with a mental health first aid, but to provide mental health first aid in order to prevent a crisis from worsening for those members of your communities. So don't wait for a particular need. Make sure that you fill that need first and foremost by building a rock solid foundation of community-based support for mental health care. So this I would implore to everyone listening to do your best to please support these kind of measures. So I'm going to ask that this Ramadan, if you're willing to give, to any particular organization or any particular service, AMP would be my recommendation for you to donate towards, because the work that we do here is absolutely critical, and the work we're going to need will be absolutely necessary as we begin to see the fallout from this pandemic. This is where AMP will be needed most of all, will be during this time to help those recover from all the pain and suffering that this pandemic has caused. So I ask that Allah subhanahu wa ta'ala bless the work that Dr. Chaudhry and Dr. Shebak are doing in their communities. I ask that he help alleviate those who are suffering, not just clinically suffering, but financially suffering, socially suffering, and communities that are suffering as well. And I also make dua that Allah subhanahu wa ta'ala help elevate the work that AMP does to meet the needs of the communities that are currently in crisis and in need of help. So Jazakallah, thank you both so much for letting me talk about the work that mental health first aid is. If anyone has any questions in particular about the specifics of mental health first aid, or like the nuts and bolts of how it works, feel free to ask, and I'll do my best to help clarify.
Thank you so much, Dr. Shareef. I think that is a really good overview of our efforts for MHFA, and I think also explains why it's so critical at a time like this to continue our training, try to aim to train instructors to get out into communities virtually, or when the time comes, if they're back in other circumstances, that people are kind of suffering overall in our community, the American Muslim community, and so many others. So if there's no access to treatment, then mental health first aid offers a way for people to kind of surround somebody who's suffering, help them understand what's going on to seek treatment. The idea is that people don't necessarily know this language of mental health. And so mental health first aid is what we decided we'd pursue 3 or 4 years ago. We began the process of moving towards achieving funding for that, because we found it critical that, if we can't get access to treatment open to everybody, if not everyone has access to a counselor or even consider seeing a counselor for whatever reason, a community member may be the one step they need to begin discussing what they're suffering. Maybe there's some opportunity for them to receive treatment somewhere. Maybe there's a path for them to kind of move towards healing. And I think when you give permission for that, maybe someone who's in your community, or a teacher or a mentor or someone, then it opens up that space, right? And so that's what mental health first aid is about. I know there's been so many successful stories. There are different questions we have here I'm going to turn to that we are getting through virtually here through Zoom. So I want to address the first question, and perhaps Dr. Shareef, you might have an answer for this one. It's about MHFA. Have previous MHFA attendees played a role that you know of, I'm sure, in supporting the community during this pandemic? Have you heard of anybody really receiving any help that way? Or
Yes, absolutely. So I can speak from my personal experience here in New York with the classes that we've taught here. One of the core things that we teach in mental health first aid, it's one of this particular section of the course I tend to emphasize a lot, which is risk assessment when it comes to the red flags of suicide and suicidality, and how to recognize when someone may be approaching behavior or actions that lead to self-harm, or, God forbid, something much worse, preparing to take their own life. And through mental health first aid training, we've actually been able to have community members spot this behavior in their community, of youth in particular, who were posting on social media very suggestive posts that they don't want to live anymore, or they don't see a point to life, or there's no reason to go on. And through the course training, they recognize that although the language is not explicit that I want to kill myself, they were able to grasp enough to realize that someone is in crisis. And they were able to reach out to that particular youth. And even though they weren't able to provide direct care, they were able to recognize that that youth needed help, and were able to connect that youth with a mental health professional who's able to help that person. That's one particular example I can think of that we had here locally. Another was that our attendees who get certified in our course have a very different way of looking at mental illness now that they did before. And this is what I think is probably one of the best aspects of the course, which is a community level destigmatization of mental illness and the way we perceive mental health in general, which is changing the cultural stigma we hold towards it. And this is what I really love, which is a lot of the communities that we provided mental health first aid courses to now had programming in their masjid specifically about domestic violence, about trauma, about abuse, about Muslims who suffer from emotional disturbances or emotional issues, dealing with family dynamics and how to navigate communication between families. So you sort of see a change in the and shift in attitude towards these important topics post mental health first aid training. So those are two things I can definitely speak to from my personal experience here in New York.
Thank you so much. Yeah, and so I think in those examples you do see that change in people's understanding, especially when it comes to suddenly newly facing this crisis. You know, that mental health first aid is kind of provides a foundation for when something like this does come along in our lives and how it impacts us, be able to open up or to connect with other people on mental health issues. I have some other questions here, and aside from the MHFA training from Fiza K, she's asking, aside from the MHFA training, what else can we do as healthcare professionals to help our community? So Dr. Shebak, do you want to take that one in terms of what you might suggest?
There's a lot, obviously. This is a healthcare professional asking, right?
I believe so, yes.
Okay. I mean, as a healthcare provider or professional or physician, just being there for your patients is extremely helpful. Screening, I think if you're in primary care, this is the right time to screen using different screening methods like the GAD-7 and the PHQ-9 and various screeners. This is the right time to do that. And little known thing that health professionals don't know is those are, you know, as an aside, those are billable codes. So when you screen, you can, there are codes for that. But to definitely screen your patients if you're in primary care, and even if you're not, this might be the appropriate time to step over and conduct those screenings. Try to get into the telehealth and telemedicine, you know, for the safety of your patients and to keep your practice going in this time, because a lot of people are not going to want to visit or come in person. So definitely do that. Encourage people to use it if they need to be seen or be screened. They can do it through telehealth services, and just be there for your patients in general and your family members.
Right, and I think I would add, as a healthcare professional, you know, we have an idea that is involved with our work, which has to do with ethics and our values as professionals. And I think when we're facing a crisis like this, there's a lot of information out there, and we know that different types of information gets, you know, interpreted in different ways. And so I think we have a responsibility as healthcare professionals to also be responsible about the information we are putting out, but also, you know, being able to send out as much education as we can on the pandemic that we know, for instance, for ourselves is related to mental health. You know, to understand that there's a lot of loss going on and that there's, you know, different kinds of loss. So a lot of people have, you know, hear different things on social media and internet overall information. And I think we kind of want to be people who are standing up for healthcare in general and making sure that we take care of different people, people who are the frontline healthcare workers, our patients, and anybody who's really suffering loss right now or trauma or anxiety, you know, from different aspects of it. So we want to get that right information out there. I think that's something we can do. We can do that through educational webinars or even speaking to people who might need an expert in our own community in a larger format like this. So I think lending our time in this type of way is really important right now, because people don't have access even, you know, to call up and say, okay, I'm going to come in to discuss the issues I'm dealing with, or, you know, think that they have to suffer alone. So it's just getting the word out education-wise is important. I think this next question is a really good one for people who are suffering from mental health issues and people who are around those individuals and how to help. This question is, how do you have a conversation with your loved ones if you think they have mental health issues? So probably we all can speak to that, but I'll take it back to Dr. Shareef to start there.
No, you guys, please, by all means, you can start.
Okay. Well, I just spoke. So how about you, Dr. Shebak? Do you have an idea about that? How do you have a conversation with your loved ones if you think they have mental health issues?
It's always tricky. It's always going to be difficult conversation to have. It's all about how you approach it. Is, you know, always start out with, if you think something is bothering the person, ask them, Is there something bothering you? Is there something you'd like to discuss with me? You know, if you have specific concerns, you can bring them up, but you have to do it in a way where they are able to save face, you know, especially if they're coming from a culture that's more Eastern, or, you know, where concept of face or honor and shame are very important and shouldn't be taken for granted. You want to allow the person to preserve that. So you want to do it in a soft way, giving them a way out, not putting too much pressure on the person to discuss it, and letting them know that you recognize that they're struggling with something without necessarily forcing forcing it on them. You know, face cultures and cultures of honor and shame, there's a very delicate process in how we communicate with one another, and to just keep that in mind. So letting them know that you know through indirect means, and then giving them a way out so that they can come to you once they're ready. But as long as you get that process going and let them know that you know, then I think that's the first step. Now, if it's something a little bit more severe, where somebody's suicidal, homicidal, hallucinating, things like that, then it's not really the best thing to necessarily have a prolonged discussion about it. You need to get them the help that they need in an emergency situation immediately. So it depends on the situation. It depends how serious it is, and it depends on if it's something that that needs emergency services or not.
Right, and I think I would answer that, you know, barring if it seems like an emergency, you know, if it seems like a suicidal crisis, somebody is at risk of, you know, a suicidal crisis, or possibly, you know, moving forward with a plan or ideas about that, you know, you do want to work on figuring out how to get them to an emergency room or seeing somebody immediately. I mean, as immediately as possible, because they're in crisis, and that's sort of something that you would have to figure out with even your primary care physician. You know, you can ask for help, and you can find a clinic that would be able to help you with that. But I think barring that, I always find when I talk to couples and families, and maybe somebody in the family or someone in the couple is dealing with more significant mental health issues, I find that leading with an example of perhaps somebody, or even if you yourself have dealt with that, or somebody that they, you know, might that they maybe even admire, or someone that's talked about it. You know, we're if you're a faithful person, you know, there are multiple examples of from different faiths of people who have talked about struggling mentally and with their mental health. So I think if you can borrow examples like that, sometimes leading with that, because it's important to destigmatize this when somebody might feel shame. And that's an example. It does help with young people, I've found, by bringing up examples of people who maybe they admired that talked about it openly. And it opens a door a little bit. I also think that, you know, just being able to say that you're there to support without pushing forward in a solution right away is an important thing when you talk to someone about mental health issues. And you are there to talk about it if they are suffering, and if there's anything going on, if it's not a crisis, but that you'd be willing to help when they're ready. You know, that's a big part of mental health treatment, is a readiness to be able to seek it so that it is helpful. And so I think those are some of the tips I've found over the years I've seen is helpful. And so, okay, so I'd like to go on to some of the other questions we have here. So the next question is about mental health first aid. So Dr. Shareef, I'll send this to you. It says, how long are mental health first aid courses for? Could you provide us with resources?
Oh, okay. Yeah, absolutely. So a typical mental health first aid course is 8 hours long. And I know that sounds a bit daunting when I say that, but within the 8 hours, there are multiple breaks that we take, and then 1 hour break for lunch. So there's plenty of break time within the course itself. The course is broken down into different sections. So we begin the course with like an overview of mental health. What is mental health? How do you distinguish what is mental illness versus what is just a simple human emotion? Then we go into like depression, then anxiety, then we go into self-harming, suicidality. We bridge that into trauma, PTSD, anxiety, panic. And then from there, we go into psychosis, schizophrenia, you know, altered mental status. And then we end the course on substance abuse and addiction. So this is like a broad range of topics that the course covers. And think of it as like a crash course. So it's a course meant for someone that has absolutely zero clinical background. You don't need to be a medical student. You don't need to have any healthcare background, not even like a college course on any of this stuff. You don't need that. It's meant for anyone who just has any basic interest in mental health. So the course is taught from a very basic perspective of what is depression, what is anxiety, what does this look like, what are some like key symptoms you can pick up on. It's not going to help you diagnose. The whole point of the course is not to have you walk out as a psychiatrist or a therapist, absolutely not. But it gives you enough tools to recognize basic signs and symptoms in both yourself, in your family, or your friends, and be able to recognize what is a crisis situation, what is not a crisis situation, how best to approach someone who may be suffering from a mental health crisis. So that's the gist of the course itself. And at the end of the course, you receive a certificate, and the certificate is valid for a period of 3 years. You can renew it online and have it renewed again for another 3 years afterwards. And that certificate basically certifies you in mental health first aid, that you are able to respond in an emotional crisis for someone who may be suffering from it. So I hope that helps give like a good gist of this course. For the virtual course in particular, there is a change. So I do want everyone to know that for the virtual course, I will never expect anyone to sit and their computer for 8 hours and be engaged. I think that's impossible to do that. So the virtual course is actually split up, where part of the course is going to be self-led online, where you do your own teaching, you have your own resources online that are made available for you. And then the second half of the course is done with an instructor in a live class. So you sort of get both flavors. You get your own self-taught curriculum that is available to you, and then the second half of the course is through guided instruction. That's how the online course is going to be different from the in-person course.
So there is a follow-up to the MHFA program, and I think that's a really good overview. Someone here is wondering if there are if it's culturally specific for the Muslim community, and I think this is a good question just to clear up. What is mental health first aid?
Yes,
who is it for?
Yeah, absolutely. So the mental health first aid course, the actual course itself, was created in Australia, believe it or not, and then from Australia it was adapted for a United States audience, like a North American audience. So the course itself, the actual core course, is a secular course. There is nothing that is cultural or religious about it. They don't even touch upon those aspects. The course simply presents mental health literally as what it is. These are just the signs and symptoms. This is how you recognize certain things. This is how you have a conversation. What makes AMP's work in particular necessary is that AMP has recruited Muslim instructors. These are Muslim mental health professionals. These are folks who have dealt with mental health themselves. They're either providers themselves or have quite a bit of experience dealing with those who are suffering from mental health challenges. So what we do is we give this the skeleton of a course a particular flavor, which is in particular that we as instructors speak from a perspective that is a Muslim-based tradition. So for when I teach the course in particular, I'll give you a quick example. The course itself gives you a general example of a typical adult male suffering from, say, depression. And they give you the example of he lost his job and this is what he's suffering from. When I teach the course, I scrap that example and I switch it with a different example. And the example I give is from actual community cases that we've had. So this would be like a Muslim male in particular who suffers from a crisis of faith. And instead of believing that it's simply a crisis of faith, he actually misses the symptoms, very, very obvious symptoms of depression, anxiety, and keeps insisting that this is something spiritual. And what I try to impress upon in the course is that when it comes to wellness, there is a holistic approach to wellness. And yes, spiritual wellness is crucial, but you can't ignore mental wellness and focus only on spiritual. So the way I like to impress the course is I give it a flavor of how does this illness or how does this particular challenge, what does it look like in a Muslim community, and how do Muslims in particular respond or even fail to respond to these particular signs and symptoms. I speak from a South Asian background myself. A lot of the co-instructors that I teach here in New York come from Arab backgrounds or come from Hispanic or African American backgrounds. So everyone speaks from their cultural perspective. But for AMP in particular, every example that I use in my training, every resource that I pull from usually has a Muslim provider or points you towards someone who is both Islamically and culturally competent in their mental health care. I hope that helps answer the question.
I think so. I think, it's important to know that we can tailor a program for a certain community, and we've gone about doing that, but we don't digress too much from the general model of what we're trying to achieve, which is mental health literacy, really, for any community. And so we can adapt certain things, but the goals, do stay the same in the curriculum itself. So I want to get to a few other questions we have here. This is a broader question, and it is discussing the historical issues that we face similarly to today. The question is there any historical precedent we can draw from in learning how to proactively promote mental health during times of great stress? Dr. Shebak, do you have any comments on that question in response to?
I think that's a huge, huge question. Historical precedents, I mean, you look at the major world-shaking events that have taken place and what's happened after those events. I like to speak about generations and how each generation gets hit with certain things and how they come out of it. Specifically, the young adults, which are your Gen Z and Gen Y and Gen Z, so millennials and centennials. They've kind of been in several crises so far. Just haven't really had that break. Whether it's when the crisis first started in 2001, millennials were kind of coming of age at that time, and then the meltdown in 08, millennials were still coming of age, and you had the Gen Z kind of coming of age, and now this. So it's been crisis after crisis. And after each time, we know the numbers that millennials have a high level of mental health issues and problems and social issues and related to money, finances, marriage, starting families. So there's a lot of precedents and things that we know from history that have happened because of crises. The same thing with the Great Depression. You had certain generations there, like the lost generation and the silent generation, etc., that had their own effects from those crises. So it's important to read those and to recognize what can happen from a crisis. But there's not much to say what we should do per se. There probably is research on that, but as far as what we should do, I think the first thing is just to recognize what crises can do, recognize the different generations and what they've dealt with, and how they have responded to those crises, so then we can mitigate it in the future for future generations. And that's really what happens after major crises. There's kind of like this rebirth, this renewal, and things start to come together again. But if they come together in a good way, we need to learn from the tragedy, whatever it may be, so that we can mitigate it in the future, right? So, we haven't had a World War II since World War II because the people that were in World War II figured that's not a really good thing. But now that they're all dying off, so we've got to kind of remember that that's not a good thing. So this is kind of our moment with this pandemic, that let's not have one of these again in the near future, because 1, 2, and 3 can happen.
Thanks so
but
much.
It's a huge question. It's definitely something that you could talk about for hours. But yeah, in short, that's what I.
Yeah, I would just add a note, and I think you talked about the different generations and how they're affected. That really what we are seeing in terms of this particular crisis, what we've heard from public health experts, and what we've learned is that there actually is no precedent we can really draw upon for this particular crisis. It doesn't mean we have not suffered trauma overall as a nation, according to our community, even within our individual communities, or overall together in a collective way. But this is so unique in its presentation to our lives disruption and different ways in which we must manage it and address the way we are living. So what I have learned from listening to public health experts and reading on the issue is that it is really a unique crisis that we have no prior, information to draw upon in terms of how will this impact us. We can only really understand the impact of trauma and loss and utilize that information. But it is yet to be seen, which is why I think knowing that mental health issues are coming to the fore, most likely, as we know, there already is collective loss, collective trauma, and people who have already suffered mental health issues are really experiencing a doubling down of that. Being in isolation, being disconnected from typical resources usually only impacts the ability to cope with your current, mental health issues. So those resources not being available is going to impact someone who has that. So we want to be prepared that a mental health, what they're calling a mental health future crisis will occur post, trying to shift back to society, that we don't band-aid the situation. So we want to understand mental health first aid, programs like this, returning to our expertise as much as we can, as we are in so many variants at the American Muslim Health Professionals, and being able to establish guides and understanding the current presentation of issues and being able to draw upon that, like in AMP, is so critical for the future. So I just wanted to make a point about that, why AMP is kind of working so hard in the mental health arena right now. I want to make sure I introduce, we've been joined by Abdur-Rahman. I want to make sure I add you in here because I see you, but I think you're on mute. And I want to make sure if you are joining us as a participant, just let me know if you are going to be making any remarks here.
Yeah, absolutely. So Assalamu alaikum, everybody. My name is Abdur-Rahman Zreba. I am actually the American Muslim Healthcare Professionals interim president, actually.
Okay, great.
And apologies for being
for the chapter. I think you're with one of our chapters, right?
Correct, the one in Texas.
Texas, yes. Okay, thank you.
Don't mind this map of Louisiana in the background. That's just from where I'm actually from. But no, actually, I apologize for actually being a bit tardy. I literally just finished another call at work and wanted to at least come give salams, and actually just mental health first aid training is actually incredibly important to me, as well as many of the people in my lives, the nature of the work that we do. And I'm really glad that actually AMHP is actually really spearheading this kind of effort. I wasn't able to actually attend Dr. Shareef's training, I believe, in Houston, but I heard wonderful things about it. I've actually attended.
We missed you, man.
And I know, man, I know. But I actually have done the mental health first aid training myself personally, and actually used it in my own life. It's incredibly valuable, and it especially changes the way that me, as just a layman, I am not a clinical provider, not a doctor, just a lowly project manager at a company, but just how we as individuals and members of society can actually look at mental health in a holistic way for people. And actually starting to kind of see it, even though you can't see like a broken arm or anything like that, like it still affects people on a fundamental level on an everyday basis of how they just do work, how they interact with their family members, and then being able to actually address that just from a human being perspective. It's an incredibly valuable course, and actually I recommend it to all of my friends. If you have not taken one previously with AMP or any of the organizations that actually do them, I know that I think Iman also does them sometimes, but in these different programs that actually do these kinds of things, it would behoove you to actually get one done.
Thank you so much, Abdur-Rahman. I want to ask you one question about that. Could you describe a little bit about, how you've seen, even with other participants or taking the training, what kinds of changes you see in discussions you have about mental health after utilizing the skills?
Absolutely. So one of the biggest changes I think that I've seen is that, especially within the Islamic community, a lot of times people consider mental health illness as something as like an issue of your faith. And maybe you aren't praying enough, or maybe you should read some more on, or maybe you're not, maybe Allah is mad at you. And a lot of people kind of go to that place where they kind of think that, and it's not necessarily the case. Also from like, I want to say from an internal perspective, I think actually also it helps you understand that it's not something that you can control. It's not your fault. And so actually removing that idea that, oh, this is something a person chooses to be depressed, like they should just go out and go exercise more, or they should do this. It doesn't work like that. And so I think it was a paradigm shift for me, just to kind of really kind of look at it from a different perspective, that this is another medical condition that 1 in 5 people actually have to deal with on a day-to-day basis. I think there are 5 of us here in this panel, and it's almost safe to say that at least one of us could have had like a mental health crisis at some point, and being able to actually have some training to actually be able to address that in a safe and effective way, I think is really helped me.
Yeah, I think that really speaks to the part of the reason we, joined with the National Council of Behavioral Health to develop the program to try to bring mental health first aid through AMP, is because we saw those kinds of issues in our community. The shame around it and stigma of just dealing with it, but also not really knowing when to get outside help along with what you normally use, like your coping skills, like your, and also how to incorporate your identity and your faith into this issue that you might be facing, So I think that's so helpful. I just want to make sure that I note that we do have chapters, all over the country. Zreba, I've never met you directly, but I think first time today, but we have so many chapters that are doing such great work. So I'm so glad that you've been trained as a chapter president. And, that's another point, that MHFA is, mental health professionals, whatever profession it is, really benefits, even somebody who's already a mental health professional or in another field like you've described. So that's the whole idea, is that we all kind of become ambassadors, of this issue, and trying to bring it, bring light and shed light on it. So I do need to end there for today. I think we've had a really good discussion, and I really appreciate Dr. Shareef Zreba, Dr. Shebak for being part of our conversation. And I do hope you consider looking towards AMP's website and also our Facebook page to kind of understand a little bit more about what we're doing in the area of mental health and get details. A lot of questions were here about the details of our programming, and you can find it all there, www.amhp.us. So I'm going to sign off here, but I thank you guys again for everybody being a part of the discussion, and thank you for everyone listening and offering up your questions.
Thanks for having me.
Okay.
So, okay, thank you.
Bye-bye.